The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. Today's episode is titled The Big Bang, the Part D Instability Factor. And it's a topic that is increasingly important, not just for policymakers or plans, but for millions of seniors who are beginning to feel the effects in very real ways. Over the past few years, many Medicare beneficiaries may have noticed something subtle, but actually significant. Their Part D drug coverage feels thinner. Deductibles are creeping up. Formularies are tightening. Cost sharing is shifting in ways that aren't always obvious at first glance. And yet, at the same time, we're told that reforms, particularly recent ones, are designed to reduce cost and improve affordability. So what's really going on here? We will take our usual 3 breaks, so let's get right into it. So, Part 1, a program built on balance. The Medicare Part D program has always been something of a paradox. It is a privately administered benefit, but one that depends heavily on government support. It operates on thin margins, but relies on a complex structure of subsidies and risk sharing to remain viable. Established under the Medicare Modernization Act of 2003, Part D was designed to strike a careful balance. Plans would compete on premiums and formularies, while the federal government would step in to absorb a meaningful share of high-cost risk. For many years, that structure worked. Plans could operate with predictable, if modest, returns. Beneficiaries benefited from relatively stable premiums and broad access to medications. And the government maintained a level of financial exposure that was manageable within the broader Medicare framework. With that introduction, we will take our first break. When we come back, we will tell you where things have begun to break down and unravel for the Part D program. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan, and we hope you are enjoying this episode. We are talking about the fact that the Part D program looks increasingly vulnerable financially and the implications on seniors. I promised to get into how the program has begun to break down a bit. So Part 2, the pressures building under the surface. To understand the instability we're seeing today, you have to start with the underlying cost trends. Drug spending, particularly for specialty medications, has been rising rapidly. Specialty drugs are used to treat cancer, autoimmune diseases, and rare conditions. They are often extraordinarily effective, but they are also extraordinarily expensive. In many cases, these therapies can cost tens or even hundreds of thousands of dollars per year. These drugs, as well as utilization and cost trends more generally, have created a much riskier and unpredictable Part D program. Next, it's important to note that Part D benefits are delivered in 2 distinct ways. First, through Medicare Advantage plans that include drug coverage, commonly referred to as MAPDs. These integrate medical and pharmacy benefits into a single plan. Second, through standalone prescription drug plans or PDPs, which are paired with traditional fee-for-service or Medicare Advantage plans that do not include drug coverage. While both operate under the same basic Part D structure, they do not operate under the same financial realities. Enrollment in MA continues to expand, and this is where structural difference really begin to show up. Medicare Advantage plans, especially MAPDs, have a key advantage: integration. Because they manage both medical and pharmacy benefits, they can offset high drug costs with savings elsewhere in the system. If a medication prevents a hospitalization, the plan benefits financially. Standalone PDPs do not have that flexibility. They operate in isolation without insight into or control over medical spending. Even more important is the bidding structure. Medicare Advantage plans can use rebate dollars from their medical bids to enhance or subsidize their drug benefits. This allows them to offer lower premiums and richer drug coverage. Standalone PDPs cannot do this. They rely solely on Part D revenue, and that makes them far more vulnerable to rising drug costs and policy changes. Over time, this has created a negative feedback loop. Some would say a death spiral for PDPs. As Medicare Advantage becomes more attractive, healthier beneficiaries tend to migrate toward these integrated plans. That leaves standalone PDPs with a comparatively higher risk population, often individuals with greater drug needs, and that in turn drives costs even higher. With that, we will take our second break, and when we come back, we will tell you how political shenanigans have also contributed to Part D's financial woes. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan, and we hope you are enjoying this episode. We are talking about the fact that the Part D program looks increasingly vulnerable financially and the implications for seniors. Now let's get to how lawmakers made the financial paradigm of Part D even worse. So Part 3, policy shock. The IRA redesign. Layered on top of these structural pressures are the policy changes introduced by the Inflation Reduction Act of 2022. The law made sweeping modifications to the Part D benefit, many of which took effect in 2024 and 2025. This was a Democratic-backed plan. The most visible change is the $2,000 annual cap on out-of-pocket costs for beneficiaries. The coverage gap was eliminated. Catastrophic cost sharing for seniors was effectively removed. On the surface, these are meaningful improvements, and for some beneficiaries, particularly those with high drug costs, they are. But the design of these changes shifted a substantial portion of financial responsibility onto plan sponsors. In particular, plans are now responsible for a larger share of costs in the catastrophic phase. That is where a lot of those specialty drug costs I mentioned earlier are. And critically, the funding mechanisms put in place to support this shift have not kept pace with the underlying cost growth. The results have been dramatic. Plan bid amounts increased sharply, by some estimates over 180% for 2025. Federal subsidy levels per enrollee have risen significantly in just a few years, and total taxpayer obligations for the program have more than doubled since 2023. Plans also are facing a growing gap between revenue and expenses, And that is hard to grapple with. We've seen reductions in benefit generosity, increased deductibles, narrow formularies, and in some cases, fewer plan choices available to beneficiaries. In other words, while the policy aimed to improve affordability, it has also introduced new forms of cost shifting, many of which are less visible but no less real. In the end, Democrats were trying to attract votes in the 24 election when they passed this in 2022, and they have totally botched the program from a federal budget perspective and from a plan perspective. There's also an unintended behavioral effect. Because out-of-pocket costs are now capped, many beneficiaries are gravitating toward ultra-low premium plans, knowing their total exposure is limited. I counsel at least a dozen friends and family each year on their Medicare choices, many of them who have PDPs, and many of them will hit the $2,000 gap each year. I search for plans that have their drugs, and then I tell them why pay $80 or more a month in premiums for a richer plan when you can have a low premium and just pay your $2,000 before the cap is reached on out-of-pocket costs. They'll pay that earlier in the year in cost sharing, but it amounts to the same. Then their drugs are free for the rest of the year. They save perhaps $700 or more a year in premiums. That's another byproduct of this ridiculous change the Democrats made in 2022. But for PDPs, that further again compresses plan revenue and adds to financial strain. Perhaps most telling is the federal government's own response. To prevent a sharp spike in premiums ahead of the 24 election, the Biden administration implemented a multi-billion-dollar premium stabilization program to limit premium hikes, essentially a temporary subsidy layered on top of an already strained system. That program continues today, even under Trump, but it does not solve the underlying problem. It simply delays the moment when those pressures fully materialize. With that, we will take our last break, and when we come back, my final thoughts on the topic. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan, and we hope you are enjoying this episode. We are talking the fact that the Part D program looks increasingly vulnerable financially and the implications on seniors. Now, my final thoughts. So Part 4, a program at a crossroads. So where does this leave Part D? In the near term, the program continues to function. Beneficiaries still have access to coverage. Plans are still participating. But the underlying trajectory is concerning, particularly for the standalone PDP market. Without the ability to cross-subsidize from medical benefits, PDPs are increasingly exposed, and as that risk pool deteriorates, the challenges compound. At the same time, broader policy decisions are being shaped by these financial realities. We've already seen hesitation around expanding coverage for certain high-cost therapies, such as GLP-1 drugs for obesity, without comorbidities. While these treatments may offer long-term savings, the short-term budget impact is difficult for plans to absorb under current conditions. Therefore, they have said they do not want to participate in the new balance model that the federal government has proposed. The federal government instead is stepping in to directly cover GLP-1 costs through 12/31/2027 to test savings and risk. another sign of strain within the system. But that is actually the right move for the Trump administration to do to encourage plans to sign up in the future. These GLP-1 drugs have the potential for huge long-term savings. I am a case in point. I've lost 90 pounds since I went on one. My blood pressure is controlled. My blood sugar numbers are now in the pre-diabetes range. My cholesterol and triglycerides are ultra low. And it makes it much less likely that my cardiovascular disease progresses in the future. Looking ahead, it's difficult to see a stable path forward for Part D without some form of recalibration. That could involve revisiting risk-sharing mechanisms, adjusting subsidy structures, or rethinking how incentives are aligned between plans, beneficiaries, and the government. What began as a carefully balanced Part D partnership is evolving into something far less stable, in great part because Democratic lawmakers were seeking to score points during elections with seniors. It is backfiring and causing more pain for most seniors. Unless the underlying dynamics are addressed, the pressures we're seeing today are unlikely to subside. They likely will get worse. That's it for today's episode of the Healthcare Labyrinth Podcast. Thanks for listening in. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.